All right, so then what is blood pressure? We hear that a lot. When you go to the doctors, that's typically one thing a person will always, or a nurse, a PA, somebody will always take your blood pressure to begin with your appointment. And there are two numbers. You know, typically you might hear something like 120 over 80 or 120 over 60. And, you know, what are those two numbers? Well, those are going to be the systolic pressure over the diastolic pressure in your heart. And the normal range for systolic pressure is 95 to 135, so typically the 120 is a good number. And then diastolic pressure, 50 to 90. All right, if you have hypertension, then you have high blood pressure. Hyper is too much. Hypotension, affecting less people in the United States, would be numbers or values lower than those numbers. All right, so what blood pressure is actually measuring is the pressure against a blood vessel wall. The highest pressure during blood ejection from the heart, that's going to be systolic pressure, and that's when the ventricles squeeze to push blood out of the heart. And then the lowest pressure is the diastolic pressure, when the ventricles relax and blood fills back into the ventricles. So, average blood pressure, 120 over 80. Now, the heart itself is a large muscle. And because it's a muscle, the heart actually needs its own blood. All right, what happens if that muscle doesn't get blood? All right, and that muscle doesn't work. All right, so blood is moving through the arteries, the pulmonary artery to get into the blood, and blood is flowing throughout the entire heart. And you're always going to have blood in your heart. But all of these blood vessels here, all right, you have the right coronary artery, you have the left coronary artery that are bringing a direct blood supply to the muscle tissue itself. That's going to support the heart's ability as a muscle to pump blood out and therefore pump blood to the rest of the body. All right, so if the blood doesn't get, if the heart doesn't get blood itself, then it's not going to pump. All right, the blood vessels, coronary artery, either the right or the left, all right, those can get choked or blocked with plaque. We'll look at plaque in a little bit. But if zero blood flow, if no blood actually gets to the heart itself, the muscle, then you're going to have a myocardial infarction, MI, or heart attack. All right, you're going to have an area within the heart. Let's say if the blockage happens right here, all right, then there isn't any blood moving through the end of this vessel, and you're going to have death of this surrounding tissue because it doesn't have any blood supply to it. All right, so why should we care about cardiovascular disease? All right, it's the most common cause of death in the Western world. Some of these disorders are hypertension, blood pressure or high blood pressure, atherosclerosis, stroke, heart attack, aneurysms, anything that are going to cause damage to or problems within the cardiovascular system. And these different disorders here are what this week's discussion forum is talking about. So hypertension, high blood pressure, this is going to result from narrowed blood vessels. That can be due to the plaque buildup. If your blood pressure is stable at 140 over 90, that's going to be considered hypertension. Again, if you are nervous, if there's something going on in your life, you can have, basically transient hypertension or even momentary hypertension where your blood pressure is high because there's stress. And transient hypertension, maybe you've got stress going on that's lasting a month. But then you alter things, you get rid of that stress, whatever the case may be, and your blood pressure goes down. All right, back to normal. That's actually pretty normal for us as humans. But sustained hypertension, not a good thing. It's called the silent killer because there's actually few symptoms that you can feel with this. And it can lead to a heart attack, stroke, kidney failure because of the problems that are associated with high blood pressure. High blood pressure, there's more pressure on the vasculature, and that can cause damage. So if you think about a riverbank and you constantly have a river or have water going across it, and occasionally you can have riverbank erosion because you have a flood that comes through and you've got a lot of water flowing that normally isn't there. It causes damage. And similar in your blood vessels, if you have too much blood going through the blood moving through your blood vessels at too high of a force, it can actually start to cause damage to the interior of those blood vessels. And that damage can lead to maybe a blood clot developing, and that can cause, if the blood clot breaks off, it can cause the stroke because that blood clot goes to the brain and blocks blood in the brain. Kidney failure, your kidneys are actually pretty sensitive to blood pressure, and so high blood pressure and all of that blood moving through your kidney to have the blood filtered, right, that can cause inflammation within the kidney and lead to kidney damage and kidney failure. All right, the next disease is atherosclerosis. All right, atherosclerosis is typically, it's a buildup of plaque within the blood vessel, and you see that here in this figure. You've got a pretty ordinary looking coronary artery, all right, and this is the coronary artery. It's sitting on the heart, supplying blood to the heart muscle itself, and this is the lumen of the artery, nice and clear, and blood is going to pass through here. Here you have plaque, all right, all of this garbage material, and you can see then there's actually very little room relative to all of this white space for blood to pass through, and so then the heart muscle itself is not going to get enough blood. All right, if plaque is stationary, all right, actually stuck to the blood vessel, it's going to be a thrombus. If it becomes detached and it breaks off, all right, then it becomes an embolus. And the embolus is then going to travel throughout the blood, all right, just going to follow the path of blood, and it can get into your leg, and you can have severe pain and actually death of muscle tissue there. It can move to the lungs, and you can have an embolism, a pulmonary embolism, and it's going to cause a lack of blood flow within the lung tissue, or it can go to the brain and lead to a stroke. All right, so atherosclerosis is associated with stroke and heart attacks. Now, atherosclerosis is often associated with high cholesterol levels, and that is true. The plaque itself is going to start with some sort of damage to the vasculature, to the inside of that blood vessel, and that damage can actually be high blood pressure. But then if you have high cholesterol on top of that, the cholesterol can be kind of sticky, and if you have an injury because of high blood pressure, then that cholesterol, the high levels of cholesterol can then stick to that injury site and start to build, and then that's how the plaque develops. Now, some people can have high blood pressure and never develop atherosclerosis. Some people may not have high blood pressure, but they actually have high cholesterol, and they develop plaque because there's other ways that damage can occur to the vasculature, and that cholesterol can then start to sit on the surface of that blood vessel. And there's some people who have high blood pressure and high cholesterol and actually never develop atherosclerosis that the physicians are actually aware of. So some of this is luck, and some of this is poor luck. All right, so then a stroke occurs when the cranial artery is blocked or ruptures. And so then part of the brain dies due to the lack of oxygen. Some of the symptoms are numbness of the hands and face, difficulty speaking, inability to see in one eye. And depending on how long there is a lack of oxygen to that area of the brain will depend on how severe and how lasting the effect is of that stroke. An aneurysm is a ballooning of the blood vessel. All right, so the blood vessel becomes weak, and it's a muscle, if you remember, and that muscle is going to try to maintain its shape. But if there's a weakening in that muscle, then that weakened spot is going to be pushed out, kind of like blowing a bubble in gum, and how as the bubble in your gum gets bigger, right, the surface area or the thickness of the gum becomes thinner. And finally, you keep blowing, and there's a weak spot, and the bubble bursts. Right, that's very similar to what you might find with an aneurysm. All right, common places are in the abdomen and in the vessels that move to the brain. And the problem is that sometimes it can be caught. Other times it doesn't get noticed until the aneurysm actually ruptures. All right, and then when it ruptures, then you have a hole in your blood vessel. And depending on where it is, if it's an aortic aneurysm, right, an aneurysm in the aorta artery, all right, that's big. There's a lot of blood moving through there, so you can actually bleed out and have death follow very quickly. If it's in a smaller area, a small blood vessel, then you may have some time to seek medical attention and have some correction there. All right, the heart attack, aka myocardial infarction, all right, MI, not Mission Impossible here. The coronary artery is blocked, and so part of the heart dies. And symptoms of this is going to be with pain that generally radiates down the left arm, and this is going to be seen most often in men. But you can sometimes see that in women, but a lot of times women don't have the same effect, but rather women get nauseous. And so it's actually a major player in death of women because the signs and symptoms are not clear. All right, I randomly get nauseous, whether it's because of a migraine coming on, or I'm super tired, or I don't eat well. I can get nauseous for a variety of reasons. But I don't know that I've ever thought when I've gotten nauseous is, oh dear, I'm having a heart attack, I need to go seek medical attention. Whereas with the pain that radiates from the left arm, all right, that is worrisome, very key. And if you have that, you're going to seek medical attention, or at least you should. All right, so we've talked about cardiovascular issues. This is coming up in the discussion form of actually focusing then on health. The do's and don'ts for cardiovascular disease: exercise. All right, do not smoke or abuse drugs. Keep your weight down. Eat a healthy diet, low in fat, low in cholesterol. Know your blood cholesterol, and then don't ignore symptoms. Right? See your doctor if there's something funny going on. So then, summary of the cardiovascular system in general. We looked at the parts, right? The heart and the blood vessels. The function is to move blood throughout the body, and the end movement area, so to speak, are going to be the capillaries. And hopefully you remember that the blood is refreshed at the kidneys, the lungs, and the intestines, whether it's and the liver included in there, right? Whether it's to take garbage out or add nutrients. All right, your blood pressure should be low. Cholesterol, keep it low. And we talked about some of the diseases, including heart attack.